welcome. This is the Maryland Cannabis Community Partnerships virtual conversations around coronavirus, cannabis, COVID-19, however it affects you. We're bringing in local experts, subject matter influencers, community leaders, folks who have licenses, folks who want licenses, folks who are influential in the cannabis industry. And I am very honored to have Rita here. She will be talking a bit about how cannabis, COVID, coronavirus has affected her organization, some of the ways that she's moving, and some tips that she has for our community. So this is going to be a very casual conversation because Rita and I are very casual. So bear with us as we go along with actually just starting off with the intro. Rita, tell everybody who you are and what you do.
Hi, thanks for having me, Keisha. I'm Rita Montoya. I'm the Executive Director of the Cannabis Patient Advocacy Association and our sister group, the CPAA Community Fund. We strive to bring the collective patient advocate voice for medical cannabis patients to our policymakers. The state of Maryland, that would be our legislators, the state, the Senate and the House, as well as the MMCC, both the staff and the commissioners, and anyone else who will listen. So we want to make sure that they understand that cannabis is medicine, that there are over 90,000 Marylanders who use medical cannabis for medicine, and that we need to make sure that we all have the access that we need to that medicine.
Absolutely. And I mean, these are very interesting times. I've been saying the new normal. I'm sure everyone will hear me say the new normal. Just go ahead and start ratcheting off how many times I say it throughout this series. But we are in a new normal. I mean, think about the executive orders that have come down from Governor Hogan, the guidelines and regulations that's coming from the commission. I mean, I have a grasp of what's going on, but I know that I could defer to you on just kind of breaking down what's our climate right now.
We do, and there is a new normal for a lot of people. I think, though, interestingly, a lot of medical patients, probably a lot of our medical cannabis patients, a lot of chronically ill people, a lot of immunosuppressed people, this is kind of our normal sometimes. I'm one of those people, and, we quarantine and bind ourselves to our homes for periods of time. And so for a lot of us, we're kind of used to this. We're used to stockpiling things for a month so that we don't have to go out. We're used to finding delivery services, ways to entertain ourselves when we're by ourselves, ways to keep ourselves in good mental health and emotional health. So I've noticed that a lot of those folks in our community are helping to reach out to those for whom this is the new normal and to try to help them get through this time in good spirits. So I really appreciate that about our community.
Yeah, we definitely are banding together. But I mean, it's interesting because you see the governor on TV, you see the emails coming from the commission, the dispensaries are open, then they're kind of not open, there's delivery, there's telehealth, there's just a lot of stuff that's happening. And then as a patient myself, I'm constantly trying to figure out, should I go get my medicine today? Should I implement a caregiver just in case I might not be able to get my medicine? So from your perspective, working with patient advocates, understanding what the current climate is, what are some things that we should really be thinking about based on what's been coming down the pipeline?
Yeah, Maryland is fortunate to have some really great, strong patient advocates across the state, from north to south, east to west. And the patient advocates have definitely been hard at work communicating with the commission, communicating with legislators, dispensaries, license holders, and trying to make sure that our patients can get the access that they need. We also have a great caregiver community. I know that caregivers are ready and willing to help patients. We're encouraging people to sign up to be caregivers. My understanding is that the turnaround for caregiver approval right now is pretty fast. I believe it's 1 to 2 days. We're working to try to get some help and assistance with fees for caregivers. We know that that can sometimes be an obstacle. We would really encourage patients to use caregivers as a way to minimize their risk. A lot of our patients are immunosuppressed. Also as a way to minimize risk and exposure in the community. We want to keep our license holders and their employees and staff safe as well, right? They're out there just like our nurses and our doctors doing an invaluable essential service, making sure that all of us have access to our medicine, and we want to keep them safe as possible.
Absolutely. So, I mean, we both know that the patient advocates have been hard. They have been working hard. Our caregivers, that system that's being built for folks who need caregivers, who want caregivers, fees are still in place. So hopefully that is eliminated or alleviated over the next couple of
Hmm.
weeks, especially with the state of emergency that we're under right now. But
Yeah, that's what we're hoping, that we can try to either waive the fees or get them, maybe reduced in some way. The Cannabis Patient Advocacy Association is building a caregiver directory,
nice.
um, so that people can easily access the information. There are a lot of people who are not as connected into the community as you and I. We're very fortunate to be so. Some people don't know anyone else who's a medical cannabis patient. And they might not be able to access a caregiver, but we want to make sure that they have that information, especially for our families with our, we want to make sure that everyone is able to access that. Maybe the patient is not able to, but someone in their home can look up the information for them. So it's important to have that information in a public space. And that will be posted on our website at www.patientscann.com.
Awesome. Yes. Thank you for providing that resource. I know it's a much needed resource. And like you said, we've got over 90,000 patients and all of them aren't, connected like we are, especially in those counties where there's one dispensary or no dispensaries.
Yes.
So, um, just before we wrap up, is there anything that cannabis patients, our community should be aware of as someone who can be affected by what's happening in the ecosystem right now as far as the coronavirus or any other respiratory immune things that may necessarily attack your immune system, so to speak? I'll rephrase it.
Yeah, I, I, I'm concerned about people smoking cannabis right now. I really am. You need to know what's in your cannabis. We know that coronavirus is a respiratory illness. We want to keep our bodies as healthy as we possibly can right now in terms of what we're putting in our bodies, what we're surrounding, the type of energy that we're in. All of that helps our bodies to heal if they are under attack. And I would just caution people to know what is in your cannabis, know what else is going into your lungs, because things that do not belong there can harm them, and that leaves you more vulnerable. We don't know the nature of this virus, and that's part of where the fear comes. And so I think that we just all have to be as healthy as possible. I definitely, I rely heavily on RSO at this point, so my smoking is pretty minimal these days, regardless.
Mhm.
But especially now, I think that it's important to try to just give ourselves the best chance that we can. So minimize exposure for yourself and others, and stay as healthy as you otherwise can.
Absolutely. Well, thank you so much. Those are great tips. Know what you're smoking. Check out RSO if you don't necessarily aren't too sure. But if folks have no idea where to find you, let us know where we can find you, where we can connect with the association, how we could sign up for the Caregiver Directory, all those details.
Yes. Well, you can find us on social media on Instagram at Patients Can, and that's can with two N's, just like cannabis. You can also find us online at www.patientscann.com. And if you click the Locate a Caregiver tab, you can submit your own information to be listed in the directory. And then you can also access the directory information through there. If you have any issues, you can email me directly at RITAM, as in Mary, at patientscan.com.
Awesome. Well, thank you so much for being with us here today.
Thank you.
And I will make sure this information is spread as far and as wide, and everyone just stay safe. Stay safe.